You are listening to the Keep the Weight Off podcast with Dr. Angela
and Marshall,
episode number 149.
Welcome to the Keep the Weight Off podcast, where we bust all the dieting myths and discover not just how to lose weight, but more importantly, how to keep it off. We go way beyond the food, and we use science and psychology to give you strategies that work. And now your host, Dr. Angela Zechmann.
All right, everyone. Welcome to the podcast this week. We have a very special guest today. Super, super excited. This is my colleague and friend, Dr. Carolyn Francavilla. So, hi, Dr. Carolyn. How are you today?
Hi, thank you for having me. I am doing great.
Yay. So, Dr. Francavilla Brown is a medical doctor specializing in obesity medicine. She's a fellow of the Obesity Medicine Association and a diplomat of the American Board of Obesity Medicine. She's also board certified in family medicine and a diplomat there. So very highly educated. She is the owner and founder of Green Mountain Partners for Health in Lakewood, Colorado, where she practices both family and obesity medicine. She also has a podcast. She hosts the Dr. Francavilla Show, which is a podcast on weight and health. And she's currently on the Obesity Medicine Association Board of Trustees and is a strong advocate for obesity care. And we're going to hear more about that later. She speaks nationally on obesity topics, including the treatment of polycystic ovarian syndrome and obesity and breastfeeding, obesity and pregnancy, exercise, nutrition, obesity advocacy issues, how to run practices. Like, she is all over the place. So I am so excited to have you here with us. So welcome to our podcast, Carolyn.
Yeah, welcome.
Thank you for having me. I'm so excited. I love listening to you guys. You have so many great tips for patients. So glad to be part of your show today.
Thank you.
Yeah, thank you.
Well, I'm super curious. What got you interested in obesity medicine? Because didn't you start out in family practice?
Yeah, well, I actually discovered obesity medicine as an intern in family medicine. And I had gone into family medicine because I was very interested in preventing health problems. And family medicine is, I think one of the fields that most clinically does that. And I've always been interested in nutrition and exercise and how that could help people. But when I discovered that there was this whole world of obesity medicine, I realized that it was a lot more complicated than telling people to exercise or eat a certain way. And I just feel like helping people with their weight is one of the biggest picture things I can do to help with health. People live longer, they live better. And it just is the low hanging fruit in healthcare a lot of times. Like, if we can help someone lose 5% of their body weight, we can really change their long-term health in terms of heart attacks, diabetes, cancer. And so if I can prevent those things from happening, I'd be much happier than solving those problems once they already happen.
Yeah, you're so right. You're absolutely so right. When I was in medical school, I was in medical school in the 80s. So like the mid 80s. And I was told that if somebody came in and they were struggling with their weight, you need to give them 2 prescriptions. One prescription was to go to Weight Watchers. And the reason you give them prescriptions is because they'll pay attention if it's been written on a prescription pad, right? So go to Weight Watchers. And then the other one was to join the YMCA. So it was diet and exercise.
Yes,
were you trained that too?
Interestingly, I didn't realize that I was being taught by one of the leaders in obesity medicine. So Dr. Dan Bessison, who was just the president of the Obesity Society, was one of my professors in med school. And so even though I still got very little exposure to treating obesity, I think I actually got a little bit more than the average med student. And so I heard him talk, and I was just immediately drawn to this person who was trying to treat diabetes in a way that wasn't just medications. And so I think that also sparked my interest a little bit, that there are doctors out there that were talking with their patients in a deeper way about nutrition. And we're trying to get to the root cause as opposed to just, giving more and more medications. So I actually just really reflected on it recently. I was like, even though we had very minimal, I think I got a little taste of it compared to most people, even in the modern day. Even now, students really do not get taught very much about obesity or how to treat it.
I know. And it's such a crime because it's the underlying problem for almost all health conditions.
Absolutely. Absolutely. Yeah. It
like,
has such a huge effect on our health.
It really does. Yeah. So for those of you who are listening to this podcast, just know that, most of us were not trained during medical school, and very few of us were trained in residency how to treat obesity. And so it's a specialized field. And so it's just really wonderful to have another specialist on the podcast so that we can talk about all this stuff. So again, welcome. So I have a question for you, Dr. Carolyn. Why do you think it's so difficult for people to keep weight off once they've lost it?
So there's lots and lots of reasons why it's easy to gain weight and why it is difficult to lose it and keep it off. Mm-hmm. But the most fundamental thing that I always talk about is the physiology, which is our bodies are designed to gain weight and keep it on. And so when we start to lose weight, our body takes that as a really bad sign, and our body's really smart. And so it will actually decrease our metabolic rate as we start cutting calories. And so if you've ever tried to lose weight and you have gone on a specific nutrition plan, it will work for a period of time. For some people, that's weeks. For some people, that's months or a year, but eventually you stop losing weight on that plan. And sometimes that happens really quickly. And that's because our body's really smart. It just burns a little less calories as we eat less calories to adjust. And the second thing that happens is that our hunger and our feeling of satiety, our feeling of fullness and staying full between meals goes down because our body wants us to eat and regain that weight. And that's why I think a lot of people start to feel frustrated because they're like, I'm doing the same thing. It was working a month ago and now I'm not losing weight. And if anything, I'm starting to gain because I just can't keep doing this. Right. And then we layer, life circumstances and injury that prevents exercise, life stress, holidays, travel, all these other things on top of it. And at a certain point, you're like, I just can't do this anymore. Right. Like it just gets too tough. And so we're constantly fighting our biology in many different ways. And I think recognizing that's really, really powerful.
Yeah, I couldn't agree with you more. I could not agree with you more. It is just like we are, it was interesting because I recently watched, I don't know if you've heard of it, it's called Prehistoric Planet. It's a show on Apple TV.
No, but I just got Apple TV, so.
Yeah, and there's a show and it's all about the dinosaurs. And it really struck me, and I've actually been talking with my patients about this because dinosaurs evolved, dinosaurs were around 66 million years ago, and then they all disappeared 65 million years ago. And you really get the sense from watching this, it's a computer-generated imagery of all of these various crazy different types of dinosaurs. And you really just get the sense of how important food and reproduction is to the survival of the species. And I was thinking about that. It's like, our primitive brains, in order for us to survive, if there's food around, we're going to eat it. Like, period.
Yeah.
Like that. So we're fighting against our primitive brains and we're fighting against our biology when we live in this food environment that is so robust with so much that's available to us.
As a family physician, when I see someone who's really low on that BMI, on the border of a normal weight, I'm always sort of wondering, like, what's wrong with this person, right? Because especially living in the modern world, it's like really, really hard to be that lead. And so they're not absorbing food well. Like, what is going on? Because our bodies really are designed to gain weight, to store energy. But we live in a world where there's like a lot of energy available to us now.
Yeah. There certainly is. So what do we do about this? Like, is there hope?
Yeah, I mean, there's so many different things, right? Yeah. And I think first, I always think it's really important to recognize that it's not your fault and that there is powerful biology at play and that we live in a world where there's really easy to eat food, right? This processed food, or what we sometimes even now categorize as ultra processed food, the thing where you can't even recognize any of the ingredients. Something like a Dorito or an Oreo where you're like, what is this? Like, I don't even
or
know.
Twinkie.
Look at the ingredients, a Twinkie. You're like, what is this actually made of? Like, I couldn't make this on my own if I tried, right? I couldn't go buy the ingredients at the store and make this. And those foods are designed to be really palatable. They're supposed to be really enjoyable. They're really easy to eat, and they're easy to eat too much of. And they're easier for our body to get energy out of. So if you eat something that's harder to digest, like, a piece of salmon in a salad, you're not going to get as many calories out of it, even if it's the same portion of calories as if you eat, I don't know why I'm picking on Doritos today, but that's the food I'm picking on today.
There's so many options.
There's so many. I just chose that one today. I don't think I've picked on that particular food before. But like your body's actually able to get more calories out of these ultra processed foods because they're already partially broken down. And then it's starting to look like they change the bacteria in our gut as well. And so that has this whole effect on weight and health and hormones. And so it's really complicated. There's really complicated biology at play here. And then we live in this world where food is making it harder for us to lose weight. So I recently have been telling my patients, this conversation often leads to discussing medications in my clinic. I'm a big advocate for treating obesity with medications. I think that's a powerful tool for many people.
Is, for sure.
And like, look, they're kind of hesitant about medications sometimes. I'm like, look, I think one of the alternatives would be like, you could go live on a tropical island where you you catch all your own food and you grow all your own food and you get away from the stress of your job and the stress of the modern world. And you just like chill and like make all your own food. But barring dramatic change where we remove you from the stressful environment where you live and we remove you from the food in that environment, like it's going to be really hard for you to make lasting change without something like a medication. And it doesn't mean everyone needs to take a medication, but people by the time they've come to see me have tried a lot of other things. And so that's often where I will give them a lot of hope. And these medications can be massive game changers for people because now they can finally follow that plan that their doctor or their dietitian or that they have always wanted to follow. Now they actually get rid of the food chatter. They actually feel full and they can follow the plan that they wanted to.
Yeah. So you're talking about the injectable weight loss medications.
It varies. I've practiced obesity medicine for more than a decade. And so, those medications were not available when I first started practicing. And so I use older medications like phentermine and topiramate. I am actually a fan of the medication Contrave. I think it can work great for certain people. And then, of course, our new powerful medications like Wegovy and Zechmann as well. And it's, we have to figure out what makes sense for the individual patient, which medication, they're most comfortable with or that they can get access to in some cases.
Yeah, that's another piece to it too, is trying to get the insurance companies to cover some of these more powerful ones. But as
I, use the more powerful medications, I'm blown away by them. But then I also have noticed, the people who are on our older medications, again, our phentermine topiramate or Contrave, who sometimes have similar results, right? I see people with 20 or 30% weight loss with other medications. And so, we have to know that those are still there too. We have older, generic, very affordable medications that often work. They're not as consistent. People are a little more like they respond to those meds or they don't, but they're there. And so, if you've looked to see if you get coverage for one of the new meds like Wegovy or Zepbound and you can't afford them, well, you may be able to talk to a specialist who can use an older, cheaper medication that may work really well for you.
Yeah. I have plenty of patients who achieve 30% weight loss on phentermine, and phentermine and really working with their nutrition and being consistent with their visits too. That's the other piece of it.
Yes. I love that. So I tell a lot of my patients that I'm like, the one thing that is the most consistent thing of my patients' success is how often they follow up with me. So the people who come in every month in the beginning and then, go to the every 3 months that we do long term and they don't ever miss an appointment, they have the most long-term success. The people who are a little more willy-nilly or disappear for long periods of time or only come in when they've lost weight, like they don't have the long-term success. So a lot of the coaching and the support is really powerful too.
Yeah. So you're noticing that people will only come in if they've lost weight?
I have to talk to people about that in the beginning because in the beginning, when they're losing weight, they're so happy. They're so excited. They're really proud of themselves. They like seeing the reaction from me supporting them. And so I have to remind them, like, I'm here for you, even in the months you don't lose weight or the months you gain weight. That's actually when you need me the most, right?
Right.
Because we have to figure out like what went wrong, what isn't working. And that's what I'm really good at doing, right? Like we'll troubleshoot. Do we need to adjust a med? Like what was triggering the emotional eating or the binge binge eating, what's not working for your body. And sometimes I find these patterns that people have not noticed for themselves, right? Like, well, you used to have a job where you had to walk around the office a lot, and now your job's all sitting, or now you're doing all this travel, or you're going through all this stress. Like, something happened there, and like, how do we solve that problem?
Yeah. Marshall, talk about what people say to you sometimes, because she's my medical assistant, so she hears it all first. Like, tell our audience what people will say to you when they're coming in with their tail between their legs.
Oh my gosh. Yeah. So those people are my heroes.
Yeah.
And they, a lot of times, like you said, they come in only when they, have lost weight. And the people that are not doing well, they have a really hard time coming in. So when they do make it to the clinic, we really try to praise them and give them a lot of support, because they have a million reasons why they didn't do well, and they don't want to be there, and they feel ashamed, or they feel like they're going to be in trouble, or, they often say they don't want to get yelled at, which we would never do.
I know, right?
But they, those people really, really are my heroes of their weight loss journey, because it is so hard to make it in when you just don't feel like you're doing well. So we do hear that a lot in the clinic. And, we just try to give them a lot of extra support and really praise them for making it in.
Yeah. And I like to say, hey, you know what? If you had asthma and you were wheezing, you wouldn't not go to your doctor. Like, obesity is a disease. It's not a character flaw. And so you need to go to your doctor if you're struggling with this disease, because we need to make some changes in your medication. Maybe there are some other interventions that will work for you better. Like we need to address it. We don't want you to keep struggling with this. So it's just really difficult for people because they're so used to thinking of themselves as having willpower problems.
Yes.
Right.
Yes. So I try to hit that right from the beginning, that I'm here no matter what. And that's when you're really going to need me most, is when it's hard. Right. So when it's easy, it's, losing weight is hard, but it's not nearly as hard as keeping it off, right? Because there's a bunch of physiology that kicks in that makes it hard to maintain weight. And then like life starts happening, and then it's not as rewarding, right? When you're checking off metrics or you're losing weight, it's exciting. You're like, okay, I lost a pound this week. I lost 10 pounds this month, whatever. It's very exciting, and you get that reward. But when you're just maintaining, like, it's a lot harder. Like, you don't get that reward every month to be like, oh, I lost weight. You're like, okay, so this is just my life. I just weigh this now. Like, where's the dopamine? Where do I get my reward for doing a good job this month?
Right. It's just challenging. The whole thing is just challenging. And so I think it's important to presence that for people so that they understand, like, it's not always rosy when you're dealing with this disease, and you really need help. You need support from really helpful medical professionals, and sometimes you need psychologists involved. And there's just so much that goes into helping you with this disease. So can I ask you a different question?
Yes,
Carolyn?
of course.
So this is something that I would like to know more about, and it is binge eating disorder. So you have a special expertise in binge eating disorder. So I would like to know, like, how do you define binge eating disorder, and how do you treat binge eating disorder? And how would somebody know if they have binge eating disorder?
Binge eating disorder is defined by the American Psychiatric Association. So they have a definition of that. And essentially, it is overeating in a discrete period of time, eating what is, quote, definitely larger amount than what someone else would in a similar period of time. So you have a 2-hour window where you're eating a lot of food. Sometimes when I ask people about binge eating, they will say, oh yeah, I go to a restaurant and I eat the entire cheeseburger and fries and I totally have a binge. And that is probably not a binge, because people all over the country are doing that as we speak, right? Like a lot of people are going to eat an entire big cheeseburger, an entire French fries. And so that's not significantly more. But if you ate that entire meal and then afterwards you felt compelled to finish your partner's meal and then to go home and, eat an entire box of cookies or an entire thing of ice cream or a whole thing of chips, that might be considered a binge eating. And when you're overeating in this time period, you have a sense of lack of control. You feel like you can't stop, or you feel like you're going back for more. Like you're like, okay, I'm done. And the next thing you know, you're eating again. Some people even kind of black out when it's happening. Like they don't even remember. Like they're like, oh my gosh, did I eat that entire thing of crackers? Like when did that happen? Yeah. So this feeling of lack of control, you're not consciously eating it. So sometimes we consciously eat too much, right? I distinctly remember doing that this summer. I had a meal at a restaurant and I was served creme brulee. And after the first two bites, I was totally full. Like I did not need more food, but I kept eating it because it was so good, you know? And it's like, that's not a binge episode. I was intentionally eating it because it tasted really good and I was full and I didn't need it, but I wasn't out of control. I was choosing to eat too much in that time period, right? So that's different. There's a lack of control. And then the other thing that happens is one of some of these things. You eat very, very quickly. You might feel uncomfortably full. So you kind of eat yourself sick. You are eating and you know you're not physically hungry. So you're continuing to eat. You're like, I'm not hungry, but I'm still going to eat all of this. You'll often feel embarrassed or feel shame. Some people will often eat in secret because of these binge episodes. So they might eat fast food in their car or eat sort of like a bunch of donuts in secret or something without anyone being around. And you often feel depressed, guilty, or disgusted with yourself afterwards. So essentially it's eating a lot more than someone else, feeling out of control, and then feeling either physically or emotionally uncomfortable after that episode. And then for this to be, so that's what a binge looks like. And then for it to be a disorder, this needs to be happening at least once a week for 3 months. So if you do this like once or twice a year, then that's not a disorder. You might have binge episodes, but it's not a disorder. So it's something that should be consistently happening for it to be considered a disorder.
Okay. So how frequently is it?
The
once a
minimum
week?
Would be like once a week would be to be considered
for at least 3 months.
For at least 3 months.
Okay.
And then we kind of score it beyond that. So some people, if it's once a week, that's like mild. But if you're having it, say, like 2 or 3 times a day, that would be extreme binge eating. So we kind of score it, from mild to severe to extreme based on how often those binge episodes happen.
Yeah. Yeah. You know, the interesting thing that I've noticed about when I screen for binge eating disorder is I can always tell when somebody actually has it because they'll start crying.
Yeah.
There's so much shame involved in this. There's just so much shame. And then I have to reassure them, I just have to really let you know, this is not a willpower issue. This is not a character flaw. This is brain chemistry that's causing this. And that oftentimes can help.
Yes. And a lot of people haven't recognized that they have it. So sometimes when you describe it, people will kind of realize over time, like, oh, that is me. I'm not, I didn't really, because it is such a shameful experience for many people that they kind of ignore how severe it is. And so sometimes introducing people to the idea of it, and then they kind of, watch what they're doing and realize that is them. They really do feel out of control. They do feel like they can't stop. And it is very upsetting when it happens. Yeah. I feel like I was going to say something else about it. And then I think, recognizing that people can have had it in the past and sometimes it will flare at different times in their life too. So, may have been something they experienced in the past, but, no longer have going on.
Yeah. Or maybe they've experienced it in the past. They haven't done it in a long time. And then, they go through a divorce or one of their parents dies or something sort of really emotionally stressful. And they find themselves doing that again. I see that once in a while.
Oh, and you mentioned, you mentioned that it is a mental health diagnosis, and it does go along with or overlap with other mental health diagnoses. So, people who have depression are, you're more likely to have binge eating. In addition to that, ADHD overlaps with it as well. So I have a lot of patients that have ADHD
I didn't know that
also have binge eating.
Ah, okay. Great.
Yeah. And it kind of makes sense with the ADHD because with ADHD, there's this lack of impulse control. And so, and there's this constant need for this dopamine in the brain. And so that can often lead to these overeating episodes for people who have ADHD and have binge eating as well.
Yeah. And in case there's a listener that doesn't know what ADHD is, it's attention deficit disorder, and there can be a hyperactive component to it. So it's ADHD, it's attention deficit hyperactivity disorder. If it's just ADD, it's attention deficit disorder. And that's really interesting because isn't one of the treatments for binge eating disorder also a medication for ADD?
In fact, as of right now, there's only one FDA approved medication for binge eating disorder. That is a medication that's brand name called Vyvanse, or lisdexamfetamine is the generic.
Yeah.
And it did just go generic about 3 or 4 months ago.
Ooh.
So that's actually an affordable option now for people.
Oh, that's good.
But that's the only med that's been approved. And it's an ADHD medicine as well. So there's a lot of overlap in that brain chemistry. It definitely does not mean that if you have binge eating disorder, you have ADHD. And certainly not everyone with ADHD has binge eating disorder, but they definitely can go together. For people. And one of the meds that we use for ADHD is, in fact, a med that we use for binge eating, and that's that Vyvanse.
Yeah. Are there any other medications that you found helpful to use for binge eating disorder?
Yeah, so that's the only one that's approved, but a lot of medications classically that we used were the antidepressant medicines. So medications like Zoloft or other antidepressants are commonly used and can be very helpful, especially if someone also does have some depression or anxiety.
Yeah.
And then another medication that is used for binge eating disorder is topiramate. And that's part of one of our weight loss drugs, right? Phentermine plus topiramate. But topiramate by itself can also be a medication that's used for binge eating disorder. Yeah. Sometimes we use higher doses of that medication to help with the binge eating. But that's another medication that can also be utilized. And then there's no data yet. There's been a few published articles, but no big studies. But it looks like our newer medications like Wegovy and Zechmann are also going to be useful for binge eating. And I would say in my clinic, they have been very useful for my patients.
I have noticed that too. Yeah. Yeah. So there's hope.
There's lots of hope. And I find for my patients, recognizing binge eating disorder is so powerful because, again, people have so much like shame and secrecy around these episodes of overeating. Yeah. And sometimes just addressing it and recognizing it is really powerful and can help take steps forward, whether it's just through recognizing the behavior and coming up with different ways to be successful, or whether it's doing therapy, or whether it's using a medication. The first step, I think, really is to recognize if you have binge eating disorder, and then kind of take the shame away, recognize that it is a disorder, it is being driven by the brain, and there's things we can do.
Yeah. And it's not a character flaw. I mean, it's
not a character flaw, just like ADHD or depression are not character flaws. They're just how your brain is wired.
Yeah, exactly. Well, what else do people need to know about binge eating disorder or obesity treatment?
I think one of the most important things for binge eating disorder is that for most people, there's different types of binge eating disorder, but for most people, being on a restrictive diet, being on a strict diet is going to make it worse. And so I tend to have most of my patients with binge eating disorder try to eat 3 meals a day. Yeah. So I usually will have them eat breakfast, lunch, and dinner. They can have more meals than that if their body needs that, and try to have balanced meals. But I try not to be super strict about what those meals have. Because a lot of people with binge eating, the more they restrict, then when they do have sort of an emotional time period or they get hungry, that will trigger that binge episode. So restriction can worsen binge eating over time. And sometimes people with binge eating disorder will be very successful on a strict diet for, 6 months or something. Yeah. And then they sort of relapse. And so if you're someone who's always really struggled with dieting and tend to sort of rebound in a really dramatic way and it triggers overeating, then binge eating disorder may be part of what's going on for you. And then again, regular meals, people don't tend to binge eat at breakfast. That's unusual. I can't say that I've seen that clinically. You'd have to have that really severe binge eating disorder where you probably need pretty significant care from an eating disorder expert. Most people binge eat later in the day. And so if you're hungry and you go to eat and you have this disorder, you're much more likely to overeat, right? So, and oftentimes people are not hungry in the morning when they have binge eating disorder. Right. And so getting in that habit of having a high protein breakfast can be really powerful and preventing getting to that place of overhungry. So, and because people with binge eating disorder often struggle with their weight, but not always, they tend to be chronic dieters. And so it just kind of creates this cycle for them.
Yeah. Yeah. Oh, Marshall, do you have any questions for Carolyn?
No, I can't really think of anything. I think that you guys have covered everything. Yeah. Thank you. This has been really interesting. Thanks.
Yeah. So, Dr. Carolyn, how can people connect with you?
Yeah, so if you want to listen to my podcast on health and weight, it's called The Dr. Francavilla Show.
Okay.
Francavilla is with a C.
Okay.
And hopefully we can put that in your notes.
Yes, we shall do that.
And if you happen to be in Colorado and you're looking for help with weight, we're at Green Mountain Partners for Health, and I have a whole team there who does all this stuff.
Yeah.
But yeah, checking out the podcast, and then on social media, I'm Dr. Francavilla, so you can find me on Facebook or Instagram.
Yay. And you're in Lakewood, Colorado. So
yes, just outside of Denver, in the Denver area, but we do telehealth, so we can see people anywhere in Colorado by telehealth.
Oh, good to know. Okay, wonderful. Yay. Okay, wonderful. So it sounds like what we want people to understand about binge eating disorder is that a lot of people have it and don't realize it. There are very specific criteria that give you a diagnosis. And I think the most important one is that it's something that happens once a week for at least 3 months.
Yeah, this is something that's happening at least once a week, right? So, but probably more for most people
it's more.
who need treatment.
That.
Yeah. So if you have this happen to you once a month or a few times a year, that's a binge episode.
Yeah.
So, and that's going to happen for lots of reasons, but it really becomes a disorder that might need therapy or a medication if it's happening more than once a week.
Yeah. Okay, great. And if you do have binge eating disorder, there's plenty of reason for hope. It's just a matter of getting to an obesity medicine specialist or to an eating disorders specialist and getting the help that you need and the medications that you need. That would be very, very helpful. So that's wonderful. The other thing I want our listeners to know is that Dr. Francavilla is very, very active in advocacy work. And can you just tell us a little bit about what you're doing?
Yeah. So I think there's a lot of advocacy we need to know. And the first is, recognizing obesity as a disease. So I've been very involved with the American Medical Association, and that organization recognized obesity as a disease more than 10 years ago.
Yeah.
Unfortunately, not a ton has changed. And one of the biggest issues is that insurance is not required to cover obesity as a disease.
Yeah,
and so, if you have insurance and you get breast cancer or you get irritable bowel syndrome, they have to cover those, but they do not have to cover obesity. And so most people do not have access to medications that are covered by their plans. So one of the big issues is that Medicare does not cover it. And they actually have a policy that was made decades ago saying they won't cover weight loss medications. So obviously what we've learned about weight is very different than what we thought decades ago, but there's a really outdated Medicare policy about this. So there is a bill that has been introduced into Congress several times called the Treat and Reduce Obesity Act, or TROA. And so if you think that people should have access to these medications or that obesity should be treated even with lifestyle, including counseling on diet and exercise, then you would want to support covering this bill. And I can send you the link if you'd like. The Obesity Action Coalition has an easy way. People can spend maybe 1 minute. They just put in their address and it will send a letter to their representatives in Congress.
Really?
Asking for support of this bill. And so if we get Medicare coverage, then it'll be a lot easier to get coverage for other insurances. And then we've been working in many states throughout the country to get Medicaid coverage for these medications, because Medicaid is different in every state. So that's been one of the big advocacy things, is recognizing this as a disease and then trying to get required treatment for this so that people have access to surgery, they have access to medications, and they even have access to just having these conversations, because those conversations often are not even paid. If you want to talk about weight with your doctor, insurance may not pay for that. And that's just not helping any of us move forward.
Right. Yes, I couldn't agree more. Well, thank you so much for all that work that you're doing. And we'll definitely put a link in our show notes so that if you want to help us help advocate for obesity care, you can just click the link and send in your address and get a letter going to your representative. That's a great idea. Wonderful. Okay. Thank you so much. Is there anything else that I missed that you want to say, Dr. Carolyn?
I don't think so.
Okay.
Thank you so much for having me on. It's been such a pleasure.
It has been great. Thank you so much. And I really, really appreciate your taking the time to be with us on the podcast today. And thank you. Thank you so much for all of the work that you do. It's really, really important. All right. Take care, everyone. And we will see you next week. Bye.
All right. Goodbye, everybody.
Hey, Hey, if you really want to lose weight and keep it off for good, your next step is to sign up for Dr. Angela's free weight loss course, where you're going to learn everything you need to get started on your weight loss journey the right way. Just head over to JourneyBeyondWeightLoss.com/free course to sign up. Also, it would be awesome if you could take a few moments and write a review on iTunes. Thanks, and we'll see you in Journey Beyond Weight Loss.